Black.
Thank you, Speaker. On Wednesdays, the CSG directs questions to committee chairs, and therefore my question today is for my honourable colleague, the Chair of the Standing Committee on Social Affairs, Science and Technology. Senator Omidvar, I and many Canadians are interested in your committee's study on suicide prevention and how it might benefit rural areas and the first responders that continue to serve and protect our smaller communities. As we know, mental health challenges affect people of all ages, education, income levels and cultures. In any given year, 1 in 5 Canadians will personally experience a mental health problem or illness. We also know that rural communities often have issues accessing many services, including the health sector. Witnesses have come forward in your committee study that continue to drive this narrative. In many cases, mental health-related services and supports in rural communities are less comprehensive, available and accessible than in urban areas. What is your committee hearing from witnesses that will help address the difficulties rural first responders face in mental health resource access Canada-wide, and how will your committee continue to support rural first responders for the benefit of all Canadians? Thank you. Merci. Miigwech.
Senator Omidvar, question.
Thank you, Senator Black, for that question. It's a timely one since we're almost ready to complete our deliberations. Sadly, as you know, suicide does not recognize the boundaries of a city or a town. It lives within the boundaries of the mind. But unfortunately, it is part of our national narrative, regardless of size and region. We have heard from a number of witnesses, Senator Black, on the issues that you have raised. On the one hand, the imbalance, I would say, between the need for services and the access to resources. We heard in particular from remote northern communities, and we heard about the Inuit and Indigenous realities. We also heard from a medical professional with an interesting framework addressing the questions that you have put on the table in terms of rural responders and access. We've also had some discussions on the higher incidence of firearm ownership in rural communities and the link to suicide, as suicide by firearm is far more lethal than other means. However, our study is not a study about suicide. It is a study that evaluates the national suicide prevention framework. It's therefore a big picture look at the troubling rate of suicide and what the framework needs to do to address its priorities, actions, outcomes, and reporting going forward. And I hope the Chamber will welcome the report that we will table not too far off in the future and look at its proposals that we are making to the Government of Canada. I hope that answers your question, Senator Black.